chat. Hooray! Okay, did I hear someone say anal sex? Because I am here to bisect every aspect of that particular topic. All right, it's so nice to have you guys on this live chat and this live video. I really, really, really appreciate. I love you. I love you. I love you. So, before I start the main thing, I just want to do a little preamble here. Okay, I want to do a little preamble. There is this thing in medicine or in medical field. So if the benefit outweighs the risk, it's actually a principle. If the benefit outweighs the risk, then we go ahead and do it. But if the risk outweighs the benefit, it's a no, no. We do not consider it. All right. So, in other words, that is the principle we are going to apply while bisecting this topic. So, I have to be honest with you guys. I was very, very meticulous about putting down some notes because, hey, I don't want us to miss any aspect of this topic, especially today is our first live video. All right, so I want us to do a little anatomy on this topic. We're going to look at the anatomy of the anal canal or the anus. Now, every part of the body is lined by an epithelium, and this epithelium demands or suggests what goes into this part of the body or what does not go into this part of the body. Am I making sense there? Okay. So down to the epithelium that the anus is lined with. Now the anus is lined with the non-keratinized stratified squamous epithelium. The non-keratinized stratified squamous epithelium is the type that does not really condone wear and tear, unlike the keratinized squamous stratified squamous epithelium. Okay, so in other words, or let me put it this way. Now you see this skin, the skin here, the skin of my palm, all these are lined by keratinized stratified squamous epithelium, and that is the reason why I can actually use sponge on my body. I can use sponge and woo, we're good. Wow, nice and smooth, nice and lovely. It feels great. But I cannot use sponge here. In my eyeballs. I don't want to get irritated, all right? I can't use sponge there. I can't use sponge down my throat. So when you try brushing and your brush is going where it should not, you see yourself gagging. You're like, oh, does that really make sense now? So these are the epithelium that lines different parts of the body. There are more actually, but we're focusing on the anal canal. Okay, down to the next thing that I outlined. So it's more like, I just want to bring it to where everyone understands. It's more like when the use of something is actually mangled. Okay, let's put it this way. Now, I have an earring, and the earring is meant majorly for the ear, and there are nose rings for the nose. Okay, so now I can't use the earring, or I can't put the earring in my eyes. I'm definitely going to go blind. But you can try it if you think it works that way. You can try it if you think it works that way. So you see, when the use of something is mangled or is abused, we are definitely going down with some problems to solve afterwards. All right, so down to the next thing I outlined. It's more like when an individual has constipation. If you have constipation, or if you have ever had constipation, you will understand me now. And she was so uncomfortable. She had to tell almost everyone in the hostel that, man, it is so hard living this way. I mean, it is so hard living this way. And I was like, wow. So constipation is more like it drags the whole skin. It drags the whole anal skin. So just imagine. This tool is meant to be, I mean, the physics you put in the loo is meant to be in semi-solid form. So if this tool is not in semi-solid form, it's more like so solid than you can ever imagine. It definitely causes you some discomfort, and you find out that sometimes when you push out the stool, there are some strains of blood in it. There are some strains of blood in it. So it's for you to understand the kind of how delicate the skin or the epithelium with which the anus is lined with is. Okay, so we go down to the next outline point. I was watching, or I bumped into a video and I decided to watch. So this video consists of this lady. The lady in question had the whole of her hand, I mean, all the way from the tip here down to somewhere here. She had it stuck up in her anus, and I was like, what? What is happening? Why would you do something like that? I mean, some people love kinky stuffs and all that. So, but I felt for this lady. I nearly passed out. I was like, why would you have your hand? My hand is small. Why would you have your hand stuck up in your anus? Why? For what pleasure, really? For what? So, and the ease with which her hand slipped in it, I got to understand that, man, the anal sphincter of this lady is so porous, definitely porous. So there are some risk to this, and one of those risks is that the sphincter of the anus loses its integrity. So just like this lady in question, the lady in question, definitely the sphincter has lost its integrity. So just imagine when you every day or every week, or let's just put it this way, at different intervals, you stick up stuff into your anus. You stick up something like maybe the penis, a dildo, a sex toy, or any material, or your hand. You stick it up into your anus. Sooner or later, you will not feel much pleasure as you used to when you stick up something of that width. Let's say you used to stick up something of this size and this width in your anus, and 1 month later you stick it up again and you find out that it's not as tight as it used to be. It's not as tight as, I mean, I don't enjoy it anymore. So you find something bigger than this and you stick it up. All right, so maybe months later you'll be like, it's not as it used to be. Let's get something bigger. And you get something bigger, you get something mightier, and you keep getting something bigger until your anal sphincter, that is the door that opens so that your feces goes down the loo, your anal sphincter begins to slack and cannot help you anymore. It cannot hold your poop until when you want to let it go. So let's say you were in in a public, and then you really need to use the loo, and you really need to use the loo, but you're like, okay, I can actually find a restroom nearby. I think I can hold it in. But if we are talking about someone who has his anal sphincter this loose, once the feces comes, it goes. Once it comes, it goes, and the person is all messed up. So I, as a nurse, is definitely going to get you a pad and pad you up, because I want your comfort and I don't want it to be disgraced in the public. So that is the least I could do for you, until if at all there is a surgery to help you, then you can go for it. So we don't want such risk. We don't want such. So there is another one that I saw in the hospital where I'm working. This man came with an anal fissure. What is an anal fissure? An anal fissure is more like a laceration in the walls of the anus. in the walls of the anal canal. So it can occur anywhere at the ending part, at the rectum, wherever. So this is as a result of sticking up stuffs that should not be in the anus. Should not be in the anus, but you are sticking it up. You're like, you need this pleasure, and you keep sticking it up, and now you are down with anal fissure. Anal fissure can range from mild to severe, and trust me, severe anal fissure can be deadly. It can be deadly in the sense that you are exposed to different microorganisms, different bacteria, because damn, the physics is full of bacteria. So you are exposed to different bacteria that you don't even want to imagine. So this fissure or this laceration can open up into any tissue in the body. So just imagine when, okay, let's say as a lady now, as a lady, because as a lady, the rectum is close to the uterus, and the uterus is close to the bladder. Okay, so if we have this anal fissure around that uterus side, that means the whole of the, and we happen not to find out on time, or you are that kind of person that just want to hurt, you just want to feel okay until when you're about to die, and then you come to the hospital for checkup and for whatnot. So if you're that kind of person, that means your uterus definitely is going to be damaged, totally damaged, before you come to the hospital to get some help. Or for some people, they may go down with peritonitis. I don't know. So you see the danger, you see the risk involved. So the reason why I felt we should talk about this is because if if at all you want to go ahead and do it, you know what is involved. And if you want to, or you don't want to, you know the reason why you're saying I don't want to do this. Okay, so you're not just gonna say I don't want to do this. So if at all you are saying no to anal sex, you should have a reason strong enough to even educate the person suggesting it to you. All right, now we go down to the next one, which is anal cancer. Now, that one is, I'm just going to classify it under sexually transmitted diseases. Of course, HIV is there and all whatnot, but I believe we are all familiar with all those ones. Yeah. So we have the human papillomavirus cancer. All right. The human papillomavirus is that virus that just, in fact, is the surest way to get cancer. Once you meet with someone with human papilloma virus, it is the surest virus that gives you cancer without stress. And you hardly notices it. You hardly notice it when someone has human papilloma virus or when someone has herpes, because herpes kind of disguises. I don't know how to put it. So it's kind of hard to know when someone has human papilloma virus or when someone has herpes. But I guess this sexually transmitted disease or human papillomavirus or herpes can be also attributed to vaginal sex and even oral sex. All right, so it's more like a general sex thing. Okay? All right, so next is bleeding issues. Now, for some people that their consent were not really gotten, or for some people that got carried away and they are trying to choke her daddy. So they are trying to choke their partner with all they have down there. So these people can actually, bring about bleeding issues to the person that has stuff inserted in their anus. Okay, so just like when I was in the consulting room the other time with a urologist, and this urologist was having a digital rectal examination where you stick your index finger and your middle finger into the anus of your patient to check for any prostate issues. And I was very careful to check the reaction of some of the men, because it's definitely, urologist is mostly for men. So I was very careful to check their facial expression. None of them were happy. None of them were happy. So ladies, oh, this is for the ladies. If you're a lady, please open your ears. This is for the ladies. If any man says you should come and bend down low and give him, please tell him you are not doing that. and give him good reasons why you're not doing that. All right, because when you're going down with the issues that I just mentioned here, with the risk I just mentioned here, you're the only one that's gonna suffer for it. Okay, you're the only one that's gonna suffer for it. And in severe cases where these infections, like I said earlier, in the case of anal fissure, is the infections are not really treated or minded properly, it may lead to death. And I don't want to come and mourn you. So please, please, please take care of yourself. All right. We have come to the end of our live video. Any questions, any at all, I'll be very glad to answer. I'm sorry for a little cut and join that because of some issues we experienced, but well, thank God we're done. So any questions, I'll be very grateful to answer. Any at all? Okay, I'm waiting. Okay, seems like we don't have. We don't have. All right. So I am very, very, very impressed, and I am very thankful and grateful the people that joined us. Thank you, thank you, thank you. I love you, and I love you, and I love you. All right. See you in my next video.